Before I officially turn the presentation over, this is usually the point in time during a roundtable where I do turn the presentation over. But before I do that, I just want to tell a personal story about health and wellness programming, and why, we believe that it's so integral to the recovery process, and why we feel strongly that if space and resources allow, that as much as possible, health and wellness programming is integrated into the actual treatment experience. One of my first ever clients at the dorm, over 10 years ago, was a young adult female identified client who was really functioning at such a high level in life. She was going to school to be a social worker, had one of the kindest hearts that I'd ever experienced in my life, just a genuinely good person to the core. And she, in her early 20s, experienced her first psychotic break, and life as she knew it changed dramatically from that point forward. And when she came to treatment, she said that she loved exercising, she loved wellness, and she was, intimidated and scared to go into a conventional gym setting, but she wanted to, because she wanted to try to meet other people her age and reintegrate into life. And at that time, I was playing the role of coach, and I said, well, why don't we, go together? Because there was a lot of fear, and it was something that, we could do some exposures together. And I did go with her. And what I experienced was upsetting on many levels at a conventional, gym in New York City. This client was on some, heavy duty antipsychotic medications, and as a result, some of her motor skills were somewhat compromised. Her stomach was distended as a result of taking medications. There were numerous people that came up to her at the gym, basically asking her if she needed assistance, assuming she was pregnant, and taking a spin class. She really struggled to get her feet into the clips, and the instructors were looking at her strange, and not really trying to help her, interacting with her in the same way that they were interacting with other people in the class. At that point in time, I was protective of her. I was experiencing a ton of countertransference in the moment. But, what I realized was that she needed a safe space to be able to pursue this passion and this hobby of hers, and that this particular a conventional gym in New York City at this point in time in her recovery was not a safe space to do so. And that was when we really began thinking about how we could integrate in some of the activities on site for clients like her, so that they could have safe spaces to pursue not only these passions and hobbies, but these activities that ultimately help in the recovery process and help with symptom reduction and symptom management. So with that story, now I will turn the presentation over to Elbert, who will be talking a lot on this topic that I know that he is really passionate about as well. So to you, Elbert.
Thank you so much for that story and that share, Amanda. And thank you for the wonderful intro as well. Hello to all of you tuning in from all around the country. It seems the chat box is really lighting up. Even though we cannot physically be together, one of the wonderful things about this time, probably like one good thing, is that we are still able to connect in this virtual platform. So thank you for being here and being open to listen, to hear what I have to share with you. Just gonna share my screen real quick here so we can get started. So we'll start with just a quick agenda of what we'll be talking about today. What I'll be speaking to physical movement and awareness practices and how it supports mental health treatment. What are some of the challenges and rewards? And it's really important in this discussion that we talk a little bit about the role of trauma I mean, who here in the room in this virtual space has not lived through some sort of trauma, or maybe you've worked with or know somebody who's gone through trauma? It's a big factor in the work that we do in physical movement when working with mental health treatment. And then we'll engage in a couple of interactive activities, and I'll share a couple of case studies with you as well. So to begin, I thought it was really important to talk about what it is versus what is not. So to begin, what we do when it comes to health and wellness or physical fitness, it's a support service to mental health treatment. It is not the primary focus of a client or member's treatment. Oftentimes, we encounter that people get really excited when they come. They really want to engage in a lot of different activities, whether it be yoga, mindfulness, and that's all they really want to do. Unfortunately, we are not a gym. We are a mental health treatment center. So the focus cannot just be on that. What we do in the health and wellness fitness arena, the services are really meant to augment and support the work that our clinicians do. What we've seen again and again is that it's a really nice break for our clients, for our members, from traditional talk therapy, a time where they enter into the room, we play some music, and we start to dance, we start to see people moving and really coming out of their shells. It's a wonderful opportunity in which you see the social engagement system really being strengthened. And whether it's they're engaging fully in like 45 minutes of class, or just simply helping to roll up the mats or spray down the equipment after a workout, that repetitive pattern and that engagement piece keeps them coming back. And we just really start to see a lot of wonderful things happen. It's important that we talk a little bit about the concept of body neutrality. I think most people are familiar with body positivity, which pretty much says that health at every size. And as you all maybe know, perhaps it produces a little bit of toxic positivity. Body neutrality is more of a recognition of what the body is doing in this moment for you. So take, for example, we're all facing a global pandemic right now. COVID, it's a very real thing. All of us here, I'm going to make the assumption, because some of you have your cameras off and some of you have your cameras on, we're able to breathe without being intubated. So just recognizing that the lungs are able to take in a little bit of carbon dioxide and produce that into oxygen to nourish ourselves. Or that, in 1 minute time, 5 liters of blood is being pumped throughout the body from the heart, nourishing every single cell, organ, allowing your brain to discern. So just recognizing what the body is doing for you. I spoke a little bit about earlier that what we do in health and wellness, it's not the primary focus in mental health treatment. It's also not really meant to be a distraction or substitution for clinical treatment. Typically, Amanda spoke a little bit earlier about going to a gym with a client. The focus oftentimes in big box gyms or boutique studios, which I'm not bashing, I've worked and I love going to big box gyms. The aesthetic is really focused on having a certain type of body type. And that's not what we do when it comes to mental health treatment. It's about meeting the individual in the moment where they are at, providing a solid foundation and structure to help them and empower them to go out to the gym. You'll also find that oftentimes in those environments that I just spoke about, there's a big focus on just client retention, selling your services. That's not what this is about. If a client shows up and they don't feel in their right space, we're not going to push. We always want to work with within this realm of discomfort, but never going into a realm of dysregulation, which I'll speak a little bit about later on in the presentation. I'm going to stop sharing the screen intentionally for a moment, not a technical malfunction. So I've been speaking a lot just now, and we're all coming from places. And again, I just want to say thank you for tuning in. But I thought I'd engage you all in an interactive activity before moving on. And this is really going to set the stage, I hope, to give you a taste of what it is that we do when it comes to physical fitness, health and wellness, and mental health treatment for young adults. So I'm just going to raise my hands. You don't have to do this. I'm doing this so the camera picks it up. And we're going to make soft fists I like to think of holding like a little egg or something where you're protecting the egg. And we're just going to pat down the length of the arm. And if for whatever reason the fists are not available to you, that's okay. You can also tap your feet maybe, or maybe blinking the eyes, letting the tongue hit the roof of the mouth maybe. Okay. And as you do this, you can open the fist and give the gentle squeeze to the back muscle, the trapezius, this giant muscle where we tend to hold a lot of tension. And if you're following along by tapping the foot, you can tap along, maybe blinking the eyes. Okay. Don't forget about the other side. All right. So you can relax the body and just come back to your seated position. So if you stop and think for a moment, at any given moment, the mind is always wandering. Where's your mind right now? You don't have to answer the question, but just think. Are you fully present here in this moment? Are you thinking about something that took place earlier? Maybe something that Amanda said or that I said? Are you thinking about dinner tonight or a client you have to meet after this presentation? The mind is lost in thoughts in the future or in the past. But what is the one thing that is constant for every single person here? The body. This body is here right now in present moment. So this is the foundation in which we build upon all of our programming, all of our one-on-one services, all of our group classes, coming back to presence. And for those of you familiar with the practice of mindfulness or DBT, you'll see this in a lot of clinical therapy. This sets the stage for what we do with health and wellness and physical fitness. I'm going to come back to my screen share here for you. Okay. So always returning back to presence as the foundation and building from there. We move with purpose. We're not simply going to say, okay, come on in and let me take you through like upper body, lower body. What is the purpose of the workout that we're doing with you, the movement, right? Can you go up and down the stairs without losing your breath? Can you pick up a bag of groceries without being in pain in the lower back? So it's really a customized approach depending on the individual to tailor our programming to work with the person where they are at. You're going to hear me say that over and over again today. It's always coming back to the present moment. And as you know, that changes. Through ongoing check-ins and assessments with our clients, we continue to, as best as we can, develop programs that make sense to as wide of a range of populations and interests as we can. And we do this by going on simple things like walks or just checking in with care teams. You know, is it dance? What are some non-conventional ways to work with the populations that we serve? How can we best serve them? So always checking in, going back and resetting and bringing what makes the most sense for the community. Earlier, I spoke a little bit about trauma, right? So trauma is something that we are all familiar with. We've all experienced some sort of trauma to some degree, more or less, some more severe than others. And we see oftentimes in the world of mental health, this is very, very central to a lot of the work that we do. So one thing that I like to work with, and I like to work with the teams around trauma, is this model that I learned through my trauma-sensitive mindfulness training. And I'm going to show you a little graph because it tends to make a little bit more sense. I'm a visual learner. So on my next slide here, this is the window of tolerance that was first created by neuroscientist Dr. Rick Hansen. And then Dr. David Trelevin, who is the person I studied trauma-sensitive mindfulness, really started to refine this model a little bit more. So you see in this graph here, this window of tolerance, ideally the optimal arousal zone is where we like to get our clients to. The great news about this window of tolerance is that it's not fixed, and we can work to widen the window of tolerance for our clients. So how do we do these things, right? How do we keep our clients from becoming hyper aroused? How do we prevent them from becoming numb, where they shut off completely? Well, the answer again goes back to that practice, coming back to the body, to presence in a mindful way. The reason why I said, imagine you're holding a soft egg with the fist exercise earlier. What if I told you to squeeze to the point where you become dysregulated because we're stirring up trauma? So again, the work that we do with health and wellness and the fitness programming, it's always about widening that window of tolerance with our clients and noticing when they're entering into that area of dysregulation, right? So again, I think in the Q&A portion, I love talking about the window of tolerance. We can definitely come back and talk a little bit more about this topic. So one of my favorite quotes, discomfort is the price of admission to living a meaningful life. Susan David, she's a PhD, a doctor and researcher out of Harvard University. She wrote a book called Emotional Agility. Again, if you reflect back on your life and all the major accomplishments that you've achieved for yourself, all the things you've worked through, you can ask yourself, was it easy? Was it comfortable? Or rather, I would put money on it, it was probably uncomfortable, right? And it was a lot of hard work. And you should be really proud of that. But the thing is, if we never toe the line between discomfort and pain, or rather experience the discomfort, and because we're afraid of the pain, we never set the stage for growth to take place. And with that, transformation cannot take place as well. So a lot of the work that we do is about safely testing the boundaries of discomfort, simply as a means to develop those skills and building resilience for the body, and also hopefully a little bit stress management or stress reduction along the way. One thing, again, because I'm a visual person that I like to work with, is this wonderful universal sensation assessment tool. Oftentimes we've noticed with like one-on-one training with our clients, what ends up happening, sometimes maybe you're familiar when you're working out with your trainer or you're in a group class. How many times have you said, I can't do this, but then you do it because it's uncomfortable? The moment we start towing that line of pain, we have to be really careful not to go outside of that window of tolerance or not shrink the window of tolerance. So this is just like a really fun way, if you're a visual person, sometimes we will work with this as a way to gauge where the person is at. You know, are you feeling neutral? Is it unpleasant? Is it uncomfortable? And if you're in this red area of pain, we definitely want to put a pause on it, come back to some grounding techniques, whether it's tapping the foot or just doing a little bit of qigong like we all engaged in, squeezing the back of the muscle on the neck, identifying a piece of artwork in the room, coming back to presence. This is my friend, my coach, call him Mike. That's not really his name. I just found him on Google. So when we're working with our clients, words are really important. I was working out recently in an online group fitness class, and the coach was saying things like, come on, push through the pain. You got this. Think about that pizza you ate last night, or you're doing a great job. Get that revenge body and show your ex. I mean, who can identify? Who's been in classes where you've heard these kind of words said, or like, it hurts so good? That doesn't really work with the population that we serve, because again, going back to that image of the window of tolerance, dysregulation, regulation, this is very dysregulating language, and it also produces a lot of toxic positivity. So now we'll look at my coach, Steve. Again, I thought it was interesting because his face, he looks a little bit more stern to me, but imagine if you used words like, thank you for showing up today. I see you. You're doing a great job. I know that this is hard, and I see that you're trying your best. How would it feel if we explored this movement in this way, an alternative to something that maybe somebody is struggling with? So just a little bit more inviting language that might make a little bit more sense for the individual that you're working with, right? Okay. So I'm going to stop sharing my screen for just a moment to talk a little bit about some qualitative data that hopefully I can down the road present in a future roundtable discussion into quantitative data, because data is really important, but that's for a future discussion. When I first arrived at the dorm about 5 months ago, the immediate first thing I noticed, it was really wonderful actually. When I came for breakfast, it's one of the first things that we do at the dorm. Everybody comes in, it's a very social environment. You see oftentimes with our clients, maybe they're just waking up, or maybe the medications that they're on, if they're on medications, are not settling so well, and they seem very groggy. By the time they come into a movement class, whether it be yoga or strength training, and that music comes on, it's as if a switch gets turned on and this light comes out in the eyes, and they start smiling and they start dancing. And it's such a wonderful, wonderful thing to observe and see in our clients. You know, I wish I could say that it's myself and my team and the work that we do. It's not. It's really just about moving the body. You know, when we move our body, when we engage in physical movement, it's an outlet for trauma to be released. When you think about animals, I love animals. Dogs are my favorite. If you have one, maybe, I don't know if cats do this, but definitely with dogs, when they get scared, what do? They shake and they shake, and then they process the fear and it's gone. What do we do when we get scared? Oftentimes we're fed lines of, oh, come on, don't be so serious. Don't take that so seriously. Grow up, or man up, or whatever toxic language you might be familiar with or even been exposed to yourself. So what do we do with that pain? We hold on to it, and then we start to see injuries or pain in the body. So the moment that we can start to move the body, we can start to process a little bit of the trauma, process a little bit of that pain. Earlier, Amanda spoke about a client, and now I really love working with clients, because this is where you really start to see the work coming through, and it's really beautiful. So about 3 months ago, we had a client who arrived here, and we can call this client, we'll call him Rick. Okay. So when Rick arrived to the dorm, the names have all been changed, don't worry, protecting everybody's identities here. Rick arrived, and Rick would just pace up and down the hallways and stairs. You could see the behaviors, very dysregulated behaviors in our clinical team. He wasn't really responding too well to a lot of the clinical treatments that we were providing. So working with us, we said, okay, maybe we can engage this person, engage Rick in some yoga classes and see how he would respond to that. And we even said, how about Reiki? And would you believe it? During Reiki, Rick sat completely still in front of the screen in a virtual session for 40 minutes. And this is the same person who was unable to sit still for 5 minutes, would pace up and down the stairs in the hallway of the dorm. This transformation with Rick is proof that what we do matters and is important. I was going to share the story about another client, but then just yesterday, as I was getting ready and preparing for today's presentation, I was working with another client who I'm going to refer to as Carla. And Carla and I, we've been doing one-on-one coaching rooted in mindfulness practices, really. And Carla said something very interesting. Carla said, Elbert, I feel so much better speaking with you today. But I'm not really sure what this has to do with fitness. And then we started laughing a little bit about it. And I asked Carla a question. I said, Carla, you know, fitness, many of us often think it's only physical. It's just the body. Fitness also applies to mental. And then I went another layer deeper. I said, Carla, are the mind and body separate? Or are they one and the same? And we had a good laugh about that, me and Carla. Carla realized, and we were just talking now, mind and body are not separate. What we do with one directly affects the other. This is why what we do is so helpful in mental health treatment. How we treat our bodies has a direct impact in how the mind feels. And you might have experienced this yourself. After a hard day's work, if you go for a run or you lift some weights, take a Pilates class, you feel better, right? It's all about connecting the dots, and we help our clients to connect those dots. Okay, I feel like I've been talking a lot again, so I'm going to engage you in a little activity exercise to kind of sum up a lot of what I spoke about today. And ultimately, more than visual, I'm a feeler when it comes to learning. I like to feel things. So my hope in this interactive activity I'm about to take you on is that if you remember nothing about the words I said or what you heard, the feeling stays with you and you can take that away from today's discussion. So I'm going to invite you to refresh your postures and come into a comfortable seat in whatever way makes sense for you. And I'm going to guide using the hands again, the fists like we did earlier. But if this isn't available to you today, for whatever reason, again, you might visualize it taking place in your head, in your mind's eye. You might use your feet if that's what's available to you. So again, you can relax your fists onto the lap. I'm just putting my hands up so you can see. And we're going to use the right fist. I'm a righty. It doesn't matter which hand really. And we're going to make a soft fist with this hand. And inside of this hand is your well-being, your safety, the things that are most important to you. Okay, we don't want to grip too hard where you become dysregulated. Okay, so nice soft fist. And this other hand, the free hand, the job of this hand is simply to try to open this closed fist, that space of well-being that you've created and that you're trying to hold, so you can see what that feels like as you start to try to pry open the hand, that space of well-being and safety. How does this feel inside of your body? Okay. So we're going to relax the hands and just shake it out a little bit. Let that part of this interactive exercise go. And now part 2 of the exercise. Again, soft fist, same thing, safety and well-being. Okay. So this time, that free hand, the only thing it's going to do is come to the bottom of the closed fist to hold it. And if you want to close your eyes, if it feels safe for you to do so here, you can, just to see what it feels like, if it feels any different right now. Holding that sense of well-being and safety. And the only job of this open hand is to help and offer whatever the closed fist needs. It could even be that this fist or the hand is helping it to stay closed. Or maybe the hand says to the fist, I'm here for you, whatever it is you need. I'm here to support you, to listen, to feel. And you can slowly start to let this part of the practice go now too. Relaxing your hands, and if your eyes were closed, opening up your eyes. So this hand to fist exercise, I did not create it. I wish I did. I learned it from David Trelevin in Trauma Sensitive Mindfulness. It's hand to fist exercise. This is the feeling sensation of the work that we do when it comes to the health and wellness fitness component of mental health treatment for young adults. The supportive hand, not one of forcing, not one of saying, you ate this pizza, revenge X body, more push-ups. That's not what it is. I see you in this moment, and whatever you need, I'm going to listen. And if it's even to help you stay closed in this moment, I'm here for you. One last share screen, and I promise you we'll get to some Q&A to unpack what I spoke about today. So, oops. Not sure what happened there. Elizabeth, are you able to pull up the last screen of the presentation for me? I love quotes too,
Yes.
and thank you so much. This is a technical malfunction.
One sec.
Okay, thank you. The quote that Elizabeth is pulling up, I feel really encapsulates a lot of what I spoke to today, the work that we do. And it's from a book that it's called America's Racial Karma, written by Dr. Larry Ward. And I just found it to be perfect. And oh, okay, I can read it to you. Okay, perfect. Thank you, Elizabeth. Okay, so Larry Ward writes, offering a safe space for those who appear to be other. How do I recognize when I am in such a space? Well, my body relaxes. I feel at ease and my nervous system is no longer in a state of hypervigilance. In a safe space, I am nourished by the taste of my being welcome just as I am, with my skin just as it is. And all my gifts and talents can reveal themselves with joy, encouraged, and supported enough to learn and to grow. Thank you so much, Elizabeth. So again, thank you so much for your attention in this presentation today. So happy to be able to offer you a little taste of the work that we do here at the dorm. I love interacting with people who are here, so I'm really looking forward to this part. Amanda, I'm going to turn this over to you to share any questions that might have come up as I was blabbing, blah, blah, blah.
Thank you so much, Albert. I certainly am not going to speak for others, but I feel more relaxed at this point in time, which is not how I typically feel 40 minutes into a Zoom. So thank you for your presentation and for making this an interactive experience. It's really appreciated. You know, a lot of comments were coming in through the chat just saying, I'm loving these demonstrations. Thank you for this interactive and symbolically moving experience. So I think others share in my feelings. I'm not seeing any specific questions come through. Somebody's saying that they feel calmer as well. So I guess I would love to just open this up for discussion. And, you know, most of us are on here as providers or maybe as family members of identified clients. And my question to you all is, not only, you know, what are your thoughts about integrating these types of experiences into clinical treatment, but also into self-care for ourselves as providers, as mental wellness providers? Would love to hear from people.
Hi, everybody. Albert, thank you so much. You know, one thing that really struck me about that presentation is that everything you said and did that yielded an immediate result, it's simple stuff. And I think so often, whether it's dealing with ourselves or in helping other people, it can get so big and complicated. And, you know, you were, as Amanda said, you know, you were able to, in a 30-second activity, help us to achieve a feeling of calmness and to show how accessible that is. And even when you gave an example of, you know, what would it feel like to go into a class and have somebody react, just noticing different things instead of that pushing that we're so used to. And I just, you know, I just love the simplicity of it. And it all just seems so accessible and doable. So thanks for framing everything the way that you did.
We did have, I'm seeing a question or two coming in now. One is going back to the tolerance window. Is that part of helping clients to not get to the highs and lows, or are we working to help expand their personal window of what they can tolerate, so that what I guess what that would mean is, say, activity a certain activity typically causes a client to get to about a 7. Over time, are we trying to help that client so that the activity only gets them to a 5 instead of a 7 or an 8?
Yeah, if I'm understanding the question correctly, it's like what is the goal of that window, or like the purpose of the window? For me, because I believe that people learn in different ways. It's a visual way for us to work with clients to identify when they notice that they're becoming dysregulated or tuning out or numbing. So I think to answer your question, Amanda, or whoever asked the question, is that we're always working to widen that window of tolerance, right? Because if our window's this big, let's say, and we're always operating in here, the tendency to come out of the window, go above into that fight or flight mode, or into the freeze mode, which is below the window, it's so quick. And when we are in those zone outside of the window of tolerance, we tend to be more reactive than we are responsive. And oftentimes we start to dysregulate and make decisions that may not be the wisest or most skillful, picking fights with our family members, people who care about us, or just feeding into thoughts that may or may not be real, right? Mindfulness allows us to be a little bit more present for what is actually happening. So for me, what's coming up right now, to answer the question, it's working to widen the window of tolerance, and also recognizing that from each moment, like day to day, let's say we got the window, or using your example, Amanda, the number scale, you and I are working together, and today you felt you were at the 8. You might come in tomorrow and be at a 4, and that's okay. Recognizing that, hey, you're here, the window's this big, and it's all good. So I don't know if that really answers the question. I hope that provides a little bit more context into why that's such a meaningful and important tool that I like to go to.
Yeah, I love that explanation, Albert. And I think that what's so powerful to me is how transferable these skills are, and uh, and they are skills, right? And the more that you practice any of these wellness activities, like any other skill, when you practice, you get more confident, and you're able to use them better over time. And not only can you use them in the session with your client, but the client, the next time that they go to school and they have to give a presentation, they can use the skills. When they have to go home and have a difficult dinner with family members, they can use the skills. So they are transferable to all areas of life. And I think that, widening that window that you're talking about allows our clients to, rather than be in reaction mode to the world around us, we can respond purposefully and with intention to the world around us, which is definitely a safer and calmer place to be overall. Amy, I see a hand.
Hi, thank you, Albert and Amanda. Albert, that was lovely. And I wanted to kind of piggyback on what you're talking about in this tolerance window. It's something that you said that really stood out to me. It was that piece of like also building the awareness. And I think through the programming at the dorm, that's also a component of it, is having our clients and members start to feel and recognize when they're moving closer to either threshold, and really experience the world and their world as it's unfolding. And what also struck me too, as you were talking about expanding the window, is really thinking about too, when someone hits that hypervigilance threshold, also the time it takes for them to re-regulate, how that can shorten through these practices. So maybe someone's still going to hit that window, and yet it's not going to spiral into an awful day or unhealthy coping. And so that is also a critical component, I think, of the work that the dorm is doing in the health and wellness programming here. So thank you so much for talking about this. This is lovely.
When I first met Albert, and we decided that we really wanted to have a role dedicated to an individual who's managing all of our health and wellness programming at the dorm, and we were interviewing, and I met Albert, and he was talking about health and wellness and his approach to health and wellness. I was struck by how similar the language that Elbert used was to DBT language and language that a lot of our DBT therapists use, and how there's so much congruence between these approaches. And it's like it fits marvelously together. It enhances the treatment experience. And for some clients, learning skills in a health and wellness group or one-on-one with a health and wellness providers is much more digestible than learning skills in a therapy room with an LCSW or an LMSW. I think that's important to recognize as well. I'm seeing a couple of more questions coming in. Also, I'm seeing Shatara commenting, and another health and wellness provider are just agreeing with everything that you've been saying, Albert. I see a question about medication and medication side effects, which, we know that a lot of medications can have some pretty intense side effects, especially around how people are feeling physically, with their appetite, can impact sleep. How do you find that health and wellness programming can help with some of that?
Yeah, that's a really, really great question. And, it's something that outside of mental health treatment, typically when a person comes to work with me, for example, they're like, these are my goals. And I'm like, okay, let's do it. I'm happy. And then I'm like, let's work out 3 times per week. That's what you want to do. Boom, boom, boom. It's not so straightforward here in the world of mental health treatment because of this very question regarding medication. So this is where staying in your lane is very important, and why communication is also very important. So what I always tell my team, we've just had a couple new members join, we know what our limits are. We're not here to work with a client's medication. We need to consult with the team's coach and clinician, with our psychologist to learn about what the medications, how they interact with the client. We're not the experts in the field. And again, in the very first, one of the first few slides, what we do and what we don't do, what it is and what it's not, we're not the primary focus. We're meant to support and augment. So to answer this question about, how do we work with a person's medication, we rely on the experts, the people who are here in our world to support us, to help work through whatever a person might be on, because we focus on fitness, health and wellness, and not the medication piece. We know where our boundaries, where our window, if you will, goes to.
Thank you for that. Anybody else on this Zoom want to share experiences using health and wellness in their practice and some of the benefits that you've experienced with your clients? Or any questions around how to integrate it in? What about for self-care from the perspective of wellness providers? And I don't know, Albert, if you can speak to this, or if any of the therapists want to speak to this, but we focused a lot of this presentation in talking about how helpful health and wellness can be for our clients, but what about utilizing these practices for ourselves, especially during this particular moment in time, moment in history, where I feel that therapists are working very hard and very in demand, and we have a lot on our plates. How have people found, or are they finding, that health and wellness is helping them to better help their clients? And I don't know, Albert, if you have any tips for the clinical providers on this call around utilizing health and wellness.
Something that has really helped me a lot is to carve out time in the day, preferably first thing in the morning before checking your emails or responding to social media or anything like that, is just sitting quietly. It doesn't even be called meditation. What I do, I call it meditation, but just taking a few moments when the world is still a little bit quiet and your mind's not too woken up just yet, a nice space between like sleep and wakefulness where you can just sit and be quiet. Because I'm assuming most of the people here are are therapists, and you take on so much. It's so important, as Amanda said, to practice the self-care. And what does self-care look like? It's really about listening to yourself, what's happening inside. And how do we do that if we're not quiet for a few moments every day? So that would be my biggest thing. I'm a big supporter of meditation. That's what works for me. And also countertransference, like knowing like own what is yours and don't take on what is not. I often fall into that trap very easily. And thankfully the environment, my peers and colleagues at the dorm, the environment is such that I have support that I can talk about that. We're given that. So surround yourself with a support network for those moments when maybe you're taking on other people's pain and as your own, and other people's suffering as your own, to know, and for people to hold you accountable, saying, are you sure this is really yours and not somebody else's? Just calling it for what it is, I found to be very, very helpful.
I love that. We have a question coming in, and actually our clients have asked this question a lot. Any particular apps that are helpful to remind clients or ourselves to practice mindfulness or self-care? We are in a tech-driven world, and we work with young people, so they love their devices. Any apps though that you like or would recommend?
Absolutely. So I don't work for any of these companies, so I'm not like plugging or getting like some coin for what I'm about to say. Just let me preface that. I love Insight Timer. It's a free app that allows you to connect with people. Like when you meditate, you see who around you, around the world, around the country is meditating, and you can like friend. And I know that's something that's really important to young adults these days, this idea of this feeling, I should say, of connection, especially right now when we can't be together. Like people want to be connected. So it's kind of, but what's wonderful about it is they put a cap on how many people you can friend in a day, so that it doesn't go into that, if we're using the window metaphor, outside the window where it becomes like a little bit obsessive. It puts in a friendly reminder, you've reached your limit of 5 today, come back tomorrow. And then you see the progress. There's milestones, like you did a great job today. Like I think I just did like a 5-day milestone, and it just helps to hold me accountable. Another app that I really, really like, if you're more into like didactic and you want to learn why you're being asked to do a certain thing, it's a free app created by Dr. Richard Davidson from the University of Wisconsin. It's called Healthy Minds Innovations. So it always starts with a little bit of a didactic component, and then they will like one day, and then it's followed by a short practice so you can process and assimilate what the lesson plan is for the day. Lots of beautiful, soothing voices that just helps me to keep focused, and honestly gives me inspiration to share information and knowledge with you lovely folks. So those two are my picks.
Anybody else have any that they like that they want to share?
I have one, Amanda. This is Valerie. Hi.
Hey, Valerie.
How are you? I
you.
started this. I call it the I am meditation. Where, like Elbert said, that in between sleep and wake, I take the alphabet and I am. So I am able. I am brave. I am caring. I take myself from A to Z every morning. And I think that I've been doing it since I started this job, actually. So a little over 3 months. And it gives me a level of, first I'm still, and confidence and gratitude that I am able to be in this I am place. Because you have to think of words to come up with the alphabet letter. There's hardly anything for X. So I just say like excited or something like that. But I find that it keeps me still and prepares me for whatever's going to come in the day, because whatever I'm facing, I can say, in this moment, I am calm. And it helps me reflect back to waking up and coming in and greeting the day. So that's one of the things that I use on a regular basis that I find is really, really helpful for me. Thank you for letting me share.
Yeah, thank you, Valerie. I love that activity. We have a couple people who are recommending the Calm app, but it's not free. Uh, and there's one comment that came in, and I just want to read it, and I think it's a nice way to end, because I think it's important that everybody gets a break in between Zooms. But we had Jennifer, who chimed in the chat saying that she has to jump off, but wanted to say a quick thank you. And what resonated with Jennifer was the language that you used, Albert. I know this is hard for you. I see you are trying your best. It focuses on effort and not on outcome. And I love the gentleness of the language around physical fitness and making it more inviting, approachable, and realistic, making it kinder and less intimidating. So thank you. And I love that comment as well. So with that, thank you all so much for being with us today in this roundtable. We really want to make this part of a series, so please stay tuned for what will be next as it relates to wellness and wellness in the mental health sphere. And based on this presentation, if anybody has any questions or suggestions around what topics in regards to health and wellness you'd like to learn more about, please email us so that we can keep that in mind for our next presentation. And enjoy your weeks, and we will see you all soon.
Bye. Good job, Albert.
Thank you, everyone.